Good evening. I'm psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, you may call me in the Fort Wayne area by dialing 969-2720, or if you're calling any place else coast to coast, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's Matters of the Mind at WFWA.org. And I'll start tonight's program with a question I recently received by email. It reads, Dear Dr. Fawver, could you please explain the difference between obsessive compulsive disorder and obsessive compulsive personality disorder? They sound very similar, don't they? Well, I don't like the terminology, but that's the terminology we have in our diagnostic and statistical manual that we use in psychiatry. Obsessive compulsive disorder is an anxiety condition. Obsessive compulsive personality disorder is a personality disorder that causes you a degree of functional impairment in getting along with other people. So let's break them down. OCD, obsessive compulsive disorder, is a condition where the brain's circuitry kind of gets stuck in this front loop here, and it goes round and around, and it's kind of like the old record players where the needle gets stuck, and you have an obsessive thought on your mind. An obsessive thought being a thought that's unwanted. You don't want it to be there. You think it's silly for it's there, and you get annoyed by that obsessive thought being there. And sometimes people will then progress to having compulsions to try to get rid of the thought by washing and washing and washing because they perceive unnecessarily that they are unclean. Some people will check things over and over again because they have this unwanted thought that the doors aren't locked, or they left the stove on even though they remember turning the stove off, but they go back and check it again and again and again. It causes them problems because they're late to getting to different events. That's obsessive compulsive disorder, or OCD. Then there's obsessive compulsive personality disorder, an entirely different phenomenon, which basically is a fancy term for perfectionism to a degree that it causes you to have a hard time getting along with other people. So people with obsessive compulsive personality disorder will have perfectionism where they want things done their way. They want them done in just the right manner, and they do not want to delegate it to anybody else. They are often list makers. They are very good with schedules, but they get on everybody else's nerves because they can't allow other people to do some of the work that needs to be done. And they get upset because the work's not getting done because the person with obsessive compulsive personality disorder can't do it all him or herself. So they get more and more irritated about that. But these people are perfectionism individuals. So when you think about obsessive compulsive personality disorder, being a perfectionist is necessary to a degree. If you're a physician, if you're an attorney, if you're a carpenter, measure twice, cut once. I mean, you got to be a perfectionist. You want to have it done right, but people with OCPD, or this type of perfectionistic disorder, go to a degree where it's got to be done their way only, and they can't see gray areas where the project can be done successfully with other ideas or maybe with other different approaches. So people with obsessive compulsive personality disorder don't appear to have disturbances in brain circuitry. It's a trait that progresses to a disorder because they have trouble with getting along with other people, and it causes them to have difficulty with interpersonal relationships. It's difficulty in a job environment, and sometimes people don't want to work with them. So there's different treatments there. People think, well, gee, why do we have to have all these diagnoses in psychiatry? Well, it's the same reason why in other medical conditions you need to have diagnoses. If you just say, I have chest pain, the clinician needs to understand, okay, is this chest pain from a heart attack? Is the chest pain from a pulmonary embolism where you have a clot in your lungs? Is the chest pain from heartburn what's the chest pain? What's the origin of this chest pain? Because you're going to treat it entirely differently based on the diagnosis. And that's important with OCD versus OCPD. With obsessive compulsive disorder, we are going to use a certain type of therapy to help a person address the unwanted thoughts. And we're going to use medications with OCD that are primarily serotonin medications, often at high doses, because it seems that the serotonin medications will dampen this circuitry going round and around and around that's causing those unwanted thoughts that are just hanging on, hanging on, hanging on. With obsessive compulsive personality disorder, if a person is receptive to therapy, the whole purpose there will be to help them understand how their perfectionism and their rigidity and doing things their way all the time is getting on other people's nerves and calling them out on certain circumstances where it's caused them problems. So with OCPD, it's going to be more of a psychotherapeutic approach, and we don't use medications with obsessive compulsive personality disorder, whereas we certainly do with obsessive compulsive disorder. Thanks for your email. Let's go to our first caller. Hello, Carmen. Welcome to Matters of Mind. Carmen, you want to know what are the benefits of a support animal and what mental disorders benefit from support animals. I'm going to broaden your question there, Carmen, initially here and just talk about pets in general. Pets are fantastic for mental health in general because whether you're a dog or a cat person, I have one of each, so I can speak in an unbiased manner. They give you responsibilities. They give you company. They give you a reason to get up every day. Not uncommonly, you need to feed them. Dogs especially, you need to take them for walks. So there's emotional benefits from having a pet in a lot of different ways, as long as you get past the allergies, the expense associated, and so forth. So pets can be very helpful. An emotional support animal, you get extra benefits, extra privileges there. You have to have the proper training for these animals, and you have to have somebody who's willing to assume the liability that your animal has been properly trained to get the extra benefits that you could get with an emotional support animal. But just in general, pets can be especially helpful. When we talk about people who we are especially likely to recommend that they obtain pets, it'll be people with autism, post-traumatic stress disorder. Not uncommonly, people with chronic depression. When you have chronic depression, one of the issues you'll have is you don't want to get out of the house and you don't want to have duties and responsibilities. In those cases, maybe a dog might be helpful because a dog requires that you get up in the morning and walk him or her, get them outside, make sure they're fed. Dogs often are going to be more in your face, whereas cats are going to be more passive. So people with depression might do better with a dog in a lot of cases, although there's going to be a lot of people that'd be willing to argue with me on that cats can be more comforting with people with depression. But with any pet, the whole idea is that they give you a responsibility, they give you interaction, and many people that have difficulty interacting with people will indeed have very good interactions with pets. We see this not uncommonly with people with autism. Thanks for your call. Let's go to the next caller. Hello, Tim. Welcome to Matters of Mind.
Oh, yes, Dr. Fawver. I had a question regarding a pharmaceutical drug for depression, this Caplyta, and one of the side effects was suicidal thoughts. How can you prescribe something like that if it gives you suicidal thoughts? What part of the brain has those thoughts?
Tim, Caplyta is a medication. It was approved for the purpose of treating not only psychotic disturbances, but also depression. All of the medications that will affect the brain have that warning on them, and it's not the Food and Drug Administration is not necessarily saying that their drug is causing suicidal thoughts. It's just that if you're taking a medication that has a mood component to it, including depression, the mood component will often be accompanied with suicidal thoughts. And because of that, they put that package labeling on any medication being used for depression, bipolar depression in the case of Caplyta. The whole idea is it's not that the medication is causing suicidal thoughts. We have to watch for those kind of conditions. Now, where's the suicidal thought precaution and warning originate? Well, where that originates is 25 years ago, they did studies on children, adolescents, and young adults with certain serotonin antidepressants and a serotonin norepinephrine antidepressant by the name of venlafaxine. And with some of these children, adolescents, and young adults up to 24 years of age, with some of them, they had increased suicidal thinking and even suicidal behaviors. as they started on the antidepressant medication. They were studying these medications in these young people. And what they were noticing was that some of them had an activation of racing thoughts. They didn't need to sleep. They were impulsive. Nowadays, looking back 25 years ago, we'd say, well, gee, those children, adolescents, and young adults, they didn't have depression per se. They had more bipolar depression that was being activated by the antidepressants. So we know as healthcare clinicians that if an antidepressant medication is activating you excessively, that increased activation excessively can actually increase suicidal thoughts. And quite frankly, that suicidal thinking is in the front part of the brain if you have disturbances in serotonin functioning in the front part of the brain. So as you have decreased serotonin functioning in the front part of the brain, that's where you will have increased suicidal thinking. Well, these medications are affecting serotonin in a good way, so the studies have actually shown just the opposite of what the Food and Drug Administration precaution showed in the package inserts. The studies are showing that if you take an antidepressant for depression, you're 3 times less likely to become suicidal compared to if you don't take a medication for depression. So it confuses a lot of people. Understandably, you'd wonder about that. But with Caplyta, it's a medication used more as a mood stabilizing medication when you're using it for mood disturbances. But all medications used for depression are going to have that precaution on there, just informing us that when we assess somebody for depression, we always need to ask about thoughts of death or thoughts of suicide. And your clinician might do what's called a patient health questionnaire with 9 questions. It's called a PHQ-9. PHQ-9, the 9th question, has to do with, have you had thoughts of death or thoughts of harming yourself? And if you say yes to question number 9, then we'll go ahead and follow up and ask a lot more questions about the nature of those thoughts. So the whole idea of taking any medication for mood disturbances will be that we as clinicians have the responsibility to follow up, to ask about suicidal thoughts or behaviors. Now, do some people have suicidal thoughts or behaviors while taking some of these medications for mood disturbances? Sure. But the cause and effect relationship is controversial, and as the 25 years have progressed, I think on occasion, the Food and Drug Administration has actually speculated they might need to take that warning off of the package labeling of all these medications because, as you can expect, because of that concern, a lot of primary care physicians especially decreased and even eliminated the prescribing of antidepressant medications to children, adolescents, or young adults. And you might think, oh, that's great. Well, the prescribing for antidepressants to children, adolescents, and adults, the young adults, decreased by 20% within years after that warning was put on the label. And that sounds wonderful, less antidepressants for these younger people. Well, the problem is their suicide rate increased by 20%. Direct relationship, possibility, a lot of other things are going on in our society right now, but the suicide rate is increasing despite the antidepressant prescribing to that population under 24 years of age being decreased. So right now, there's speculation of whether that warning should actually be on there or not. But the bottom line is, as clinicians, we need to be vigilant and watching for anybody having difficulty with agitation, irritability, or decreased need for sleep anytime we start any medication for the mood. Thanks for your call. Let's go to the next caller. Hello, John. Welcome to Matters of the Mind. John, you'd wondered if magical thinking is a real thing and how disruptive can it be into your life. I'm not really clear what you're referring to as magical thinking, John. Magical thinking can be considered to be, if it's a delusion, where it's a fixed false belief, yeah, that can be problematic. A fixed false belief, John, is where you perceive that your neighbors are putting something in your automobile to make it knock and do things inappropriately, even though there's no evidence of that. And people who have delusional thoughts have fixed false beliefs. They're fixed in the sense you can't talk them out of it, and they're false because they're not true and they can't possibly be true. So fixed false beliefs are delusions. That can be problematic for many people. That is indeed a psychiatric disturbance, which is affecting this part of the brain over here by the hippocampus. The hippocampus is on top of the temporal lobe here on the yellow part of the brain. The parahippocampus is thought to be disrupted when people have delusions with fixed false beliefs. So it's a neurobiological disturbance, and some people refer to that as magical thinking. But perceiving that you can do magic and you can do things that are extraordinary, it could be a delusion. We call it a grandiose delusion in some cases. But again, if it's a fixed false belief and there's no evidence of it happening, yeah, that would be a psychiatric disturbance, John. John, thanks for your call. Let's go to our next caller. Hello, Tim. Welcome to Matters of the Mind. Tim, you want to know if there are alternatives, natural alternatives to anxiety medication. Well, let's take the herbal medications off the board then, because some certain herbal medications like theanine, which is the natural ingredient in green tea, that can be used for some people as a natural alternative to prescription anxiety medications. But the best way to treat anxiety, Tim, from a natural perspective, will be to increase your aerobic exercise, and actually your weight resistance exercise would be good for that too. So resistance exercise and aerobic exercise can both be very helpful for anxiety. It's thought that aerobic exercise is actually better for depression, and weight resistance training might be better for anxiety in general, because when you're lifting weights, you're tensing your muscles, and as you tense your muscles, you make your muscles tired. When your muscles are tired, it's more difficult to tense them, so that often is a means by which people can get relief with anxiety. So exercise, by all means, is the best way to naturally relieve anxiety. There are a lot of different breathing exercises, breathing techniques people can use. I mentioned earlier having a pet in the household. Having a dog or a cat can be helpful for many people with anxiety. But the main thing about anxiety you want to remember is to try to get your sleep on a night-by-night basis. And if you need pharmaceutical means of helping you at least get on the right track, that can be helpful, because many people with anxiety, they get in this rut where they will stay awake at night worrying, and they start thinking and ruminate about things when the lights go out. With a lack of sleep, what you'll notice is the front part of your brain doesn't work so well. So you need to have sleep to give your front part of your brain a reset and allow it to rest and be able to function better the next day. The front part of your brain is your judgment part of your brain. The front part of the brain is your thinking part of the brain, the part of the brain that allows you to make good decisions. If you're not sleeping, the front part of your brain will not work. And that's where it's really helpful for people to get a good night's sleep. And sometimes it's a matter of them getting a 2 or 3 week time period where they're able to sleep better. But very importantly, if you're having difficulty with sleeping and that's resulting in anxiety, it's important for you to get up the same time every day, even though you might not want to get up at that same time every day, and go to bed the same time every night. And in general, people need about 8 hours of sleep. People ask me that all the time. 7 to 9 hours of sleep is the range. But if you awaken in the morning and you're pretty awake and you are awakening without an alarm clock, that probably means that you got enough sleep. Thanks for your call. Let's go to next caller. Hello, Katie. Welcome to Matters of the Mind. Katie, you want to know about your daydreams. You're making it difficult for you to complete tasks. What can you do to stop drifting off and stay focused? Well, Katie, sometimes people will daydream excessively, and when you daydream excessively, it often means that the challenge ahead in front of you might not be to your liking, and you are often going off in a different world. Obviously, you catch yourself with daydreaming. Many people with attention deficit disorder will daydream excessively because their brain is, like a squirrel. It's going from one area to another, to another, to another, and that's a phenomenon that occurs with attention deficit disorder. So if it's a medical condition like ADD, that can be a factor. Otherwise, it's a matter of trying to catch yourself in the daydreams and making sure what you have in front of you is challenging enough to keep your mind on it. Let's go to our next email. Our next email reads, Dear Dr. Fawver, is it beneficial for my wife to attend appointments with me when I see a psychiatrist? Are there things that she may learn that may be helpful in my treatment? Having a spouse accompany you during your treatment sessions with a psychiatrist is fantastic. Now, granted, sometimes there might be instances where you want to see the psychiatrist one-to-one, but in many cases, we call this collateral collateral information, where we're getting the spouse or a family member just give us extra information about how the person's doing, as long as that person, the patient, is having a trusting relationship with that family member and is willing to have them on the line during a video visit or during the appointment itself in person. So having the spouse come in is really helpful, because as a patient, you're with yourself all the time. So you might not notice how things might have changed day to day, week to week, and your spouse is going to notice things about you. And if your spouse has known you for a matter of months or years or decades, sure, they're going to have a perspective on knowing your full potential and knowing that you're not right where you need to be. And your spouse is also, or family member for that matter, is going to notice when you do have improvement. They will often be the first to know. You'll notice it eventually, but the spouse or the family member will often notice the improvement. So we find that the spouse, the family member, accompanying the patient during the visit itself can be very, very helpful. Thanks for your email. Let's go to our next caller. Hello, Tasha. Welcome to Matters of the Mind. Tasha, you want to know about heat exposure. How does it affect your brain? Basically, if you have excessive heat exposure and you have heat stroke, for instance, you'll have differences in the density of the brain, differences in the fluid retention, sodium in the sodium flow of the brain. So it can be a very dangerous kind of phenomenon when the brain gets overheated. The brain's very sensitive to change, including glucose and temperature changes. So you can get delirious first, and you can die from excessive heat. But there's a lot of different factors going on there, but it has to do with fluid balance, has to do with sodium, how the glucose is being able to be metabolized in the brain. So there's a lot of different factors there, but the brain can be very, very sensitive to heat, and it's important to get enough fluids, especially in these hot days of summer. Tasha, thanks for your call. Let's go to our next caller. Hello, James. Welcome to Matters of the Mind. James, you want to know about the causes of schizophrenia. James, we'll start with the genetic component of it. It has a slight genetic component. If you have a first-degree relative, a mother or father especially, you have about a 12% chance of developing schizophrenia yourself, whereas the general population has about 1 out of 100 chance, or a 1% chance of developing schizophrenia. So having a parent with schizophrenia increases your likelihood by about 12 times. Having a brother or sister with schizophrenia increases your likelihood by about 8 times. So for one thing, there's a genetic component. Secondly, there's a environmental component. If you're raised in a loving environment where the family was very close, emotionally bonded, a lot of communication going on within the family, that will help. But the problem with schizophrenia from a neurobiological standpoint, it often develops in the womb to some degree. So as a child who is prone to having schizophrenia, you might naturally be somewhat emotionally aloof and detached. And there are autistic features that occur with people who are predisposed to having schizophrenia, such that they have a difficult time with social interactions and social cues from other people. So we hear about these premorbid symptoms of schizophrenia occurring during childhood and adolescence, and over the course of time we see that about 80, maybe 75% of those people can go on to having schizophrenia, but yet 20 to 25% of them don't. But those early premorbid symptoms can include the socially awkward type of experiences, more so than you'd expect during the childhood and adolescent years. You might notice that these people with premorbid symptoms are much more anxious. They have difficulty just taking care of themselves to a greater degree than you'd expect. They will have difficulty with kind of hearing things in the background. They'll have these very soft or quasi-psychotic type of symptoms that we have to watch very carefully. So you can see some of that developing in adolescence. Well, what happens if an adolescent is kind of anxious and they feel socially awkward? If they gravitate more toward trying marijuana, marijuana can trigger those symptoms of schizophrenia, which can be a lifelong condition. Marijuana can increase the likelihood of developing schizophrenia by some studies by as much as 200 times. So this is why I'm very apprehensive as a psychiatrist to advocate for the legalization of cannabis in the state of Indiana. We have surrounding states that are very openly legalizing the recreational use of marijuana. The problem with that is if you're under 24 years of age, especially if you have a sensitivity or a family history of having schizophrenia, that's a big, big trigger for you. So I'm telling a lot of high school kids going off to college, don't use marijuana, especially before the age of 24, because it can trigger a lot of emotional and cognitive disturbances, and catastrophically, it can actually precipitate a psychosis such as schizophrenia that might not have developed had you not used marijuana. So it's a very easy, preventable way of eliminating schizophrenia. If you don't use marijuana, it's going to be a factor that could possibly decrease the likelihood of people developing schizophrenia over the course of time. Thanks for your call. Let's go to our next caller. Hello, Shannon. Welcome to Matters of the Mind. Shannon, you want to know about the benefits of a support group versus individualized therapy for grief. The nice thing about a support group, Shannon, will be you'll be able to hear the perspectives of other people who've endured circumstances such as yourself. And that's very comforting. And it's a way of understanding what other people have gone through and how they've dealt with certain situations in a good way or a bad way. In other words, if they've had regrets on certain things they did, they're going to tell you. So a support group is a way of connecting with other people who've had shared experiences. And that's not only for grief, but that can be for a lot of different kind of conditions. Individualized therapy is where a therapist is going to talk about only your issues, and you're going to try to break down things, and you'll go back into a very personalized history and how you dealt with things in the past, coping mechanisms, different stresses going on in your life now, and you're going to try to break those down one by one and try to deal with things individually. But a support group, like the name implies, gives you support from a lot of other people. Shannon, thanks for your call. Let's go to our next email question. We have another email question, possibly. No, we don't have another email question. We have well, in that case, I'll go ahead and shut her down for tonight then. I'm psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne. If you have any questions concerning mental health issues, you may contact me via the internet at mattersofthemind@wfwa.org, and I'll try to answer your question on the air. God willing and PBS willing, I'll be back again next week. Thanks for watching. Have a good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.